Hi there, so I wanted to make this video kind of to express my feelings leading up to top surgery. I'm 2 weeks out as of today. I'm really excited. I'm also nervous. I'm nervous that I'm getting surgery. Never had surgery before, and I feel like nobody's really excited for the surgery part of top surgery. More so excited for the afterwards. As of right now, I have no clue which top surgery I'm getting. My surgeon took a look at my photos in an online call, and she told me that I'm a borderline case, so I could be a candidate for peri, but I could also always go with DI. Since I haven't had an in-person meeting with my surgeon, my pre-op consultation was with one of the nurses at the clinic. I actually won't know which method we're going with until the day of surgery. So as you can imagine, it's a little bit nerve-wracking almost. I don't want to get my hopes up, just to kind of go over my thought process a little bit when it comes to which method I'd be more willing to go with. So my surgeon, she specializes more so in the periareolar approach, but she's definitely competent and well-versed in doing double incision. I'm having my surgery with Dr. Kathleen Armstrong at the GraceMed Mississauga Clinic, and that'll be happening on April 26th. I'm really looking forward to it. However, there are kind of some things that I have to think about when it comes to deciding between which type of top surgery I want. When it comes to peri, I maybe qualify. Maybe I'm a really good candidate. I don't know. I'm not a surgeon. I can't, make that kind of decision, but I'm definitely a little on the larger side when it comes to peri. Could be a risk of some pleating just around the nipple, or some sagging of some excess skin. To me, that's not the biggest deal. What's really important to me is kind of like nipple placement. They're too low that they're under the pectoral line. I definitely would not be going with peri. However, if they're low but they're sitting on the line, I definitely consider it. I think that's kind of a natural look. I see some results where nipples are pretty high up. That's not really the result I'm looking for. I think that having them along the pec line or kind of in an 2-inch range of that is my preferred. I would be going with DI 100% if it weren't for the fact that there are some people in my life who are really interested in whether or not I'm trans. When I say this, I mean they've either asked other people if I'm trans, or they've brought up to me that someone they know thought I was trans, and it was kind of a way to subtly ask if I was. And these are people that I'm not out to, that aren't necessarily my friends, but they're definitely people who are going to be in my life for the foreseeable future, at least a really long time. Having that kind of interaction definitely makes me feel like I don't really want a top surgery with scarring. I know that a lot of times DI results look great, especially after a few years. You can barely notice the scars, but I have no idea how I scar, and especially if I have something like hypertrophic scars or highly pigmented, that's just something that I feel would cause me a lot of further dysphoria or uncomfort with my chest. It's a bit unfortunate that I've had those experiences with people. Kind of has impacted my choices and the things that I might pursue in the future. Overall, no matter which method I go with, I'm going to be super happy because no more binding. Yeah, that's the best thing ever. Wearing a binder, thinking about what clothes I have to wear, feeling comfortable in different spaces like the gym because of my chest. It'll all be over, and I'm super happy about that. So regardless of how it actually looks, if my nipples are up here or down here, I'll have a flat chest. I'm not taking my shirt off nowadays, so regardless, if I can't take my shirt off after top surgery, but I got a flat chest, it's still one heck of an improvement. I'm kind of making this video to remind myself what it was like before and what my thoughts were before surgery, because I know that as the date gets closer, I'm going to have a lot of second thoughts, especially even after surgery. I'm going to be like, ugh, I'm in a lot of pain. Maybe I'll be in a lot of pain. Why did I do this? So I think it's going to be helpful to kind of have this and look back. This is something that I'm as sure as I can be about. Nothing in life is 100%, but this is something that I'd say I'm 99% sure about. I'm not sure how much of the actual top surgery process I'm going to be able to film or anything. I'm going away for it, about 3 hours away, so I won't be in my normal home, and it's going to be a lot of commuting. So this might be kind of the last time before the actual post-surgery that I kind of discuss my surgery specifically and how I'm feeling towards it. Overall, I couldn't be happier. I'm finishing up my exams, and then about a week after my exams, I'm getting top surgery. And then I'll have about 2 months before my summer job to recover and kind of get used to everything and let everything settle. Most of my time in this month leading up to surgery has been spent looking online at results. I think I probably have over 100 photos of top surgery results on my phone just to show my surgeon the day of, kind of help her get a feel of the kind of look I'm going for. But along with this, I've also been, of course, watching a lot of videos about people documenting their journey and their post-operative care, their treatment. So some things that I've already purchased ahead of time are like the neck pillow and bio oil and some silicone scar gel. So I feel fairly prepared. I've got, baby wipes for when I can't shower. My family's been super great. They've set up a whole bedroom just for me. They've connected the TV to some kind of device where I just have to say turn on and what I want to watch. I've given them a list of the kind of foods that I can probably eat in the few days after surgery when I'm not feeling too well. Overall, I'm really looking forward to it. I'm really excited about it. The excitement definitely outweighs all of the nerves, all of the anxiety, everything. I'm about as sure of this decision as humanly possible. Nothing in life is 100%, but I'm 99% sure that this is one of the best decisions I've ever made. So yeah, top surgery. That's really exciting. Let me know if you have any questions. I'll be down in the comments responding. I'll see you next time.